So on that note, I am all set to bring to you all an interesting panel discussion. I am quite reassured about that. So this is going to be around health tech and the need for evolution. Well, that's all set. Our panelists are right there to grab your attention. And they say that wonder is the beginning of wisdom. Socrates said that, a philosopher. Well, if you're wondering and you are ready to get wise, let's all get set and welcome on board our panelist for the session, Shri Abhishek Kumar, Director, IT, National Health Authority, Government of India. Namaskar, sir. Thank you very much for joining us. We'll be seeing you shortly on the screen. But before that, allow me to welcome up next, ladies and gentlemen. Wow, it's a pleasure to be e-meeting him now, having met him before. Kunal Kapoor, actor and co-founder, Keto.com. Well, should I be speechless about him or really wordy? Well, all I have to say is that the trooper he is, a brilliant film and a theater actor, a writer, an entrepreneur that we know. I'd just like to say that he has a heart of pure sunshiny gold. Well, we're going to be hearing some very relevant perspectives from you, Kunal, we're sure, but thank you for coming and of course, your ever-warming smile that we're going to be witnessing. Thank you. And with that, we will also be inviting Hema Jagota, the Director, Clinical Solutions, Elsevier. Well, thank you, Hema, for joining us again. Our audience knows, but just for the ones who have joined in today, you are a health tech visionary with a passion for developing an integrated digital healthcare ecosystem that enhances the patient experience while improving the affordability, the availability, and also the efficiency of care. Well, thank you very much, Hema, for joining us. And with that, we'll be inviting our moderator for the session, Dr. Sandeep Sharma, the Managing Director, Deputy CTO at Deloitte Consulting. Dr. Sandeep, you provide strategy, solutions, architect, and you implement solutions in AI, analytics, data modernization, and also the automation space. Now, we were very happy to have you with us as our moderator because, we know that you're going to be stitching just the perfect discussion right out here. So let's have some fanfare music, some applauses for the very emphatically powerful panel. And Dr. Sandeep, it's over to you from here.
Hi, everyone. We all are going through with challenging time. And we belong to a country where we have unlimited demand with the limited supply. And this COVID increased our challenges exponentially. But good part is we fought this challenge with a lot of courage and competency and clarity. All industry, our 1.3 billion people, our government, everyone helped each other to fight this battle. And the center point, focus point is our people and life sciences healthcare industry. If I see one common thread in this story, I think technology is one of the common catalysts which helped us to fight this battle faster, better, and cheaper. And as our country today, panelist is also belongs to very diverse field. And I wanted to first ask question with Ms. Hema that what changes you are seeing in healthcare, especially after post-COVID time?
Sure. Thank you, Sandeep. As we all know, in India, healthcare is a resource-constrained environment. And this was all the more evident during the pandemic, in which we had to maximize our resources. So, whichever solutions that we deploy within our healthcare ecosystem have to focus on improving the productivity from the existing resources. Be it a clinician in a large city hospital or an ASHA worker who provides last mile healthcare in rural areas, they have to be empowered so that the patient and the health outcomes can be improved. Secondly, as we have seen in the pandemic, it is important that these solutions are based on latest evidence that is authentic and is peer reviewed. Most importantly, all these solutions have to be localized for India, as we know that the healthcare delivery system in India, especially at the grassroots level, where a majority of Indians stay, is very unique and it requires a localized knowledge base. So, a combination of localized, proven, evidence-based solutions that empower our caregivers and clinicians are the need of the hour.
Well said, Hema. So Mr. Abhishek, I wanted to ask next question to you because you are have the view of at India level. How in this country we are planning to change the supply chain management, because in life sciences and healthcare, supply chain is very, very important role, and technology is also playing a big role in this whole supply chain management. So where basically we are standing and how we are leveraging technology in supply chain management?
Yeah, so it is very important in any sector that providers and consumers, they are able to meet each other efficiently, right? And it is technology and digital interventions which are enabling to bridge this gap. With the intervention of digital technology, it has become easier to bridge the gap between supply and demand side. Coming specifically to a healthcare sector, we have various types of healthcare providers like doctors, clinics, hospitals of various sizes, labs. So they are the healthcare providers. On the other side, we have citizens or patients who need various types of healthcare services. So when it comes to bringing changes or modifications in the supply chain so that consumers are able to avail of the facilities or healthcare services in the best possible manner, broadly there are two components to it. One is policy and legislative component, and second is technology component, right? So technology is an enabler, and it basically facilitates matching of the two sides. But technology in itself cannot work in vacuum, and it can play an enabling role once policy and regulatory environments are created to support it, right? So I will little bit dwell upon only the technology related aspects. Policy and regulatory framework are bigger questions to be dealt with separately. When it comes to technology components, it is very important to create various registries through which identification of all the ecosystems players can take place, right? So we need the registries at central level through which various doctors, healthcare facilities, and labs, all related entities can be identified. Secondly, in the digital world, it is very important that various entities are talking in the same language so that people or ecosystem players are able to understand language of one another. So basically these two important aspects, creation of single sources of truth for various types of entity and creating common standards through which various entity providers in the digital ecosystem talk to one another seamlessly. These two components are very integral components of National Digital Health Mission, on which we are working. And post implementation of this project, as far as technology enablement of for healthcare services is concerned, that will be achieved to a great extent.
Kunal, now I'm coming to you. And when I was saying that technology is every place, every field, and keto.org is one of the great example. Whole world is coming on platform where customer to customer talking to each other and helping to each other. And crowdfunding is one of the area where everyone is leveraging the power of technology and humanity. In this COVID time period, medical crowdfunding, how it bringing the affording gap, especially in our country?
I think what the pandemic has taught us at Keto is the power of the individual. I think that has been the biggest learning for us is how powerful each individual can be. And I think we found ourselves in a situation in this country where the government and the social sector was obviously stretched, which is why the individual had to step in. And we've just found incredible amount of campaigns that were started by people who had never donated before. We've started about 13,000 campaigns on Keto, which are COVID related. We've raised about $40 million now. And these were all done mostly by individuals. There were some very big campaigns. We had a bunch of entrepreneurs that came together from across the country. They started something called Mission Oxygen. They raised about 50 crores, which is probably the highest anybody's raised on a fundraising campaign. And they not only raised the money, they also went and purchased the oxygen concentrators, imported them, made sure that the hospitals were provided with them. We also had somebody as young as 10 years old, a friend's daughter. She was watching the migrant crisis on television, and she told her dad that I don't want to just sit and watch, I want to do something. So he called me up and he said that, can she start a campaign? And she started a campaign for migrant workers, and she raised 14 lakh rupees to provide like meals to these migrant workers. So I think the biggest learning for us has been that the individual is very powerful. And as an organization, if we can empower these individuals further, they can make a huge impact in society. So yes, I think the power of the individual is something that we should not ignore, and we should sort of enhance that power.
Well said, Kunal. Really very touching story, and that's basically remind me that in this time, we all work in our space, and we all have really very good stories, lessons learned, challenges which we faced. So let's discuss about any story, challenges, and any motivational thing which you want to share in last 1.5 years during your journey.
Well, I think the biggest challenge for us as a platform, when we started off about 9 years back, nobody had heard of crowdfunding. Very few people were even aware of something like crowdfunding, that crowdfunding existed. Now, crowdfunding has become a really sort of important part of everybody's discussion, which is great, which means that we managed to create that awareness about crowdfunding. But I think, we live in a country where the whole health ecosystem, like Hema was also saying, is very underserved. There was a survey that was conducted in 2017, which said that as many as 55 million people have been pushed into poverty only because of the medical bills. And, what usually happens is when somebody falls sick, you reach out for your insurance, but we are an underinsured country. Very few people have access, have insured themselves. Then what happens is if you don't have enough insurance, you dip into your savings. If that doesn't work, then you take a loan, and often you can't pay that loan. And if that doesn't work, then you start selling property and jewelry, right? So that is usually the way things flow. Our whole attempt has been, how do we change that? If you're not insured, instead of dipping into your savings, can you reach out to people? And can you say that, look, I need help right now? Is that possible? That's always been our aim. The other thing that is the challenge is that right now crowdfunding has just only scratched the surface. We are mostly in the urban centers and urban cities, but the most help that is needed because of lack of facilities is the tier 2 and tier 3 cities and the villages. We've just started building partnerships in these tier 2 and tier 3 cities, creating awareness there about crowdfunding, tying up with NGOs so that a lot of NGOs that are offline can then come online and harness the power of crowdfunding. So I think those two are the biggest challenges. One is that the quantum of what we are dealing with is so humongous. And the second is that right now we are mostly in the urban cities and urban centers, but where we'll really be able to make a difference is the tier 2 and tier 3 cities and the villages. So that's where we want to go next.
Great vision, Kunal, I must say. Mr. Abhishek, now basically this is a segment of stories and challenges. So in the supply chain management or any other space, any story or any challenges you want to share?
Yeah, so when it comes to challenges, the challenge is pretty obvious. And the challenge is that we are seeking to create a national digital health ecosystem. What it means is that in very simple terms, various systems operating in the ecosystem should be able to talk to one another. So it is not about creating some centralized digital systems. Creation of centralized digital systems is not such a big task, and the government can definitely create it within a reasonable period of time. What is important is adoption of those registries and standards by the players in the ecosystem. Like, let us say we tell that we are creating doctors registry, which is already live for 6 union territory, right? So doctors in the ecosystem need to adopt it, and various digital systems like health information management systems, various third-party applications need to adopt and use our registry. Similarly, when it comes to standards, which is the language in digital terms for exchange of health data records or health information. So in that case, people need to adopt our standards. And as we know, there is no legislation as such to make it mandatory. And the general approach is that people should adopt these things by choice, by seeing value in these building blocks and not through coercion. That is the general approach, general philosophy being adopted in this project. So that is the biggest challenge we see as far as this journey of building a digital system is concerned. This is the major challenge. Coming to another challenge, when we talk about enabling various health and wellness services through digital system, what is important is that people should be creating health records in the digital format, right? So there are various layers like hospitals or clinics or labs need to create records in digital format. Second part is that healthcare professionals need to use these digital systems. So that is a very difficult part. As we know, doctors and professionals in our country, it may be practically difficult for them to use such digital systems, right? And we may need to leverage various technologies like natural language processing and many modern technologies to make these applications so much convenient so that healthcare professionals actually start using it. So at the bottom line, what is important to understand is that creation of various technology building blocks is not so complex task, but making various stakeholders in the ecosystem adopt these building blocks, use those registries, use those applications, and use those standards, that is the most challenging task as far as technology enablement is concerned.
So, Ms. Hema, we heard about two challenges from Kunal and Abhishek.
Actually, मेरा एक talk चल रहा है, 10 minutes के बाद मिले, 10 minutes आगे point है. हाँ.
So let's switch the gear. And can you please talk about some success stories where you are taking this whole healthcare, tech integrated healthcare ecosystem and fighting with this COVID?
Sure. So, Elsevier, as you know, is a global information analytics company, and Lancet, which is one of our most popular journals, has served as the gold standard for all the researchers, scientists, and healthcare professionals that were managing the pandemic. So, when the pandemic initially began last year in January 2020, Elsevier made all the available research free of cost to all the researchers and all the scientists working around the globe for reference. And in fact, the co-founders of BioNTech, who developed the first vaccine for COVID, have publicly gone on record and stated that the COVID information hub that the Elsevier provided was a source of reference that they used, and it helped them in ultimately developing the vaccine. Subsequently, when the pandemic evolved in India and we had our own lockdown, we provided the information hub for Indian caregivers, Indian scientists, etc. And we continue to do so even today. So the fact that the free availability of latest evidence-based research and information has enabled the scientific and the research community to develop a vaccine in just over a year is a phenomenal success story. And that shows the power of evidence-based information, and that shows how authentic evidence-based knowledge can help the different stakeholders of the healthcare community not only fight the ongoing challenge, but even in future as well.
You are absolutely right. Not even basically the whole vaccine is rolled out within a year, but with this sharing of data and sharing platform, I think if I remember correctly, within 1.5 weeks, we identified the DNA of whole and formula of whole vaccine, and we worked. So within 1.5 weeks, finding the complete formula of vaccine and start productization of that vaccine and start testing within 3 months, we almost brought 30 years or 3 years of work in 3 months. And that's the power of technology and information sharing. Because each country, and at that time, basically the whole world was flat world, where each country was sharing the data, their learnings, their failures, their success to each other, and that's helped. Thank you, Emma. So Kunal, I'm coming back to you. And here I'm asking little bit cultural related question, right? In India, asking for donation, usually still people feel that it's down upon, and especially when you are asking help for medical or education or anything related which is close to our heart, right? Are you seeing any changes? Number one. Number two, if we have to make changes and people should start accepting this, what we should do? Because last time you mentioned that now we are going from tier 1 to tier 2 and tier 3 cities. And I'm sure you have some plan to go to the villages, right? And there basically you will face these kind of challenges. So any thought on this?
Well, when we started off about 9 years back, there was a lot of hesitancy actually. There were a lot of people that needed help, but there was the embarrassment of asking strangers for help, or logon ko pata chal jayega that we're needy. We've seen that change dramatically in the last 9 years, because I think there's a couple of things that have happened. One is that a lot of people that donate on our platform actually go ahead and start a fundraiser either for somebody in their family or their friends. Because what happens usually is when you've already donated to something or someone, you feel like if I can donate to somebody, what is the shame in asking for it?
Yeah.
When somebody around me needs it. So that I think has been a big part of what we've seen. The other is that you see a lot of people who are exactly like you and come from similar stratas of society, asking for help and getting the help. In a way where they don't have to take loans, where they don't have to dip into their savings, where they don't have to sell their jewelry, where they don't have to basically destroy their own lives and be pushed into poverty. So you see a lot of people exactly like you asking for help and getting the money and getting treated. When you see that happening, you start realizing that there is no shame in asking when you need the help. The third thing that, which I think is a really important one, is that there are a lot of young people involved. Whether they're raising money or they're giving money, there's lots of very, very young people involved. And these are people that have been exposed to crowdfunding platforms across the world. I mean, in America now, 1 in 2 people have used a crowdfunding platform, which is a huge number. So you're exposed to so many fundraisers, whether they're medical, social, or entrepreneurial from across the world. That there is really no shame or embarrassment in asking when you need that money. So I think it is there's been a huge shift, and I see it all the time. And in fact, I was so happy to hear this. I was at a hospital the other day, and it's a children's hospital, and the doctor there told me that now 35-40% of the cases that they're treating are possible only because of crowdfunding. So that's a huge number. You're talking about 35-40% people, and it's a very reputable hospital as well. So when you see such huge numbers, and you actually realize the sort of impact that crowdfunding is having.
Any plan or anything which you are thinking when you will basically cross from tier 1, tier 2 cities to villages? How basically we will solve this kind of mindset? And second thing is, the platform may be not available in villages. So,
right.
Yeah.
So, I honestly don't think that we have to address this separately. I think whatever has happened on our platform has happened organically. It's not like we've gone out to tell people that it's okay to crowdfund. You know what I mean? It's just been word of mouth. It's been peer-to-peer networks. It's been, like I said, people like yourself that you see on the platform. So I feel like that is something that will happen organically, whether it's in the cities or it's tier 2 or tier 3. When you see people from similar networks raising money, I think, when the time comes where you need it, I don't think that there will be that embarrassment or shame attached to it. As far as the villages are concerned, our main focus really obviously is not raising money from the villages. It's more about raising money for the villages. So our aim really, when I talk about villages, is to make sure that we have solid partnerships. Because, one of the things that we've always tried to do is make sure that it's as transparent as possible, as trustworthy as possible, because this is a platform that is based on transparency and trust. So it's very important that we form the right partnerships in these villages, and so that we can serve the right people.
Absolutely. And I think everywhere we are seeing this fusion, and that's why the new word nowadays is phygital. Digital is going physical, and physical is going on the digital way. Right. So I think same thing is going here when you will go to the villages. So Mr. Abhishek, this another, if we will see that this year is innovation year, or we can say that from the last 1.5 years, the number of innovations happened to be honest, I never seen these kind of innovations. It's like it can be a small innovation or it can be a very big innovation, right? Earlier in my basically company, we were having 4 locations in India. And after COVID, this 4 location became 40,000 locations because each home became one location without any challenges in productivity, quality, or anything. So a lot of myth broke in this year. I also wanted to understand from you is, do you think that our hospitals or diagnostic center can be run without a physical hospital or without a physical diagnostic center? At least certain number of patients can be treated.
Yes, so see, as you rightly said, this COVID time has helped in breaking so many myths. Whenever any new innovation comes, it leads to some discomfort, and it takes time for people to get used to it. Before I come to your question, let me give one example so that it becomes clear how this process of getting used to with technology works. Like pre-COVID times, most of the meetings in government departments used to happen in physical form, right? And after COVID, when we started using various teleconferencing or video conferencing tools, in the beginning, there was some discomfort, and it is natural process of getting used to things. The way you talk to 10 people at a time, the way you conduct a conference, the way you do brainstorming. So in the beginning, it takes time to get used to it. Like let us say any video conferencing tool, normally there is a little bit of time lag, and which is quite unlike when you are talking face to face. So although they appear very small things, but getting used to these things as an organization, as a set of people, it is part of natural process of evolution, right? So now coming to your specific question of can hospitals or let us say diagnostic labs, can they operate without any physical presence? So any such question needs to be seen purely in scientific manner, whether what are the various states or processes involved in operation of a diagnostic center. So broadly, if we talk about steps involved, some person visits a diagnostic center, some sample is taken, then that sample is analyzed by an expert using some tool, and after that, the concerned person or patient can see the discharge report either in paper form or digital format, right? So one part obviously has to be manual, that is taking sample of the person, right? Taking a sample of whatever blood sample or whatever sample is to be taken, that part has to be somehow collected, and that inputs needs to go into respective diagnostic tool. Beyond that, there is nothing which can't be automated. Like most of the tools now work in automated manner. Once input is given, some sort of output can be generated by that tool. That output will be in digital format, and the patients can definitely download the report through some mobile app or some web application that is already being done by so many diagnostic centers, right? One important part here is any report or outcome by a diagnostic center has to be interpreted by some specialist. And that is where role of a project like National Digital Health Mission becomes very important. Because today, what is expected is that if it is a very complex diagnostic case, the corresponding experts may be available in very small numbers and at a very few places, mostly in metropolitan cities or other major cities where those experts are available, let us say, very complex tests involving bone marrow or some cancer, something like that. So in such cases, National Digital Health Mission is going to enable use of technology in the best possible manner, in the most efficient manner, and this will enable availability of health and wellness services to citizens in a very affordable way. Like if some, let us say, a sample is taken at a place like Lucknow, and the tool is available there. On the basis of analysis by tool, some report is generated. Now, using the interoperable digital health ecosystem of NDHN, that report may be analyzed by a healthcare professional in Chennai. There is no need to physically transmit this report. That may be analyzed by a doctor in Chennai, and the patient may be, let us say, be located at a place like Bhopal. And using mobile application, the person can see the report as well as observations made by the doctor or a specialist. So definitely all these things are doable, and COVID has helped us, as you rightly stated, in breaking many myths and changing the habits of the people.
Hema, so far we discussed about challenges, solutions, role of the technologies. Usually we have what, so what, and now what. So we discussed about what and so what. Now I'm shifting the gears to now what. Basically, in next 3 to 4 years, let's fast forward in 2025, where you are seeing life sciences, healthcare industry. Now we are living with age of with. We always watching the movie Kunal, man versus machine, but now man with machine, human intelligence with artificial intelligence, right? So where all of us are seeing in 2025 our specific areas where we will see the solution, we will see the challenges. This is a common question to all of you. Hema.
Sure. So as you spoke about the challenges, and as Mr. Abhishek also mentioned, that the adoption of virtual digital health solutions has increased. We can see that acceptance of telehealth and acceptance towards participating in virtual consultations with doctors, both on the patient's side as well as on the doctor's side. So going forward, I think the digital health revolution is going to only accelerate. The pandemic has just been one of the accelerators. We will also see that there is a need for information in a more actionable format. Let us not forget that as we transition into this new digital health environment, we also need to accelerate and empower the clinicians who are a very fundamental part of this entire healthcare ecosystem. The clinicians have to be empowered with evidence-based information, which is available to them at the point of care. They should be able to diagnose more accurately. They should be able to have a high quality of health outcomes, even in these virtual digital health environment. So, if I were to put my 2025 hat on, I see a world where we have evidence-based information which can improve healthcare delivery available to the clinicians, the specialists at the point of care. I see ASHA workers and ANMs being empowered with job aids that help them to diagnose the high-risk cases early on. And I see the use of digital technologies in coming up with personalized care recommendations, which is based on the clinical data that the clinicians enter based on their interaction with the patient. I see a seamless flow of data based on the interoperable environment that we have in the country, and a seamless flow of data across the continuum of care and linking all the different stakeholders, the doctor, the lab, the pharmacies, and the patient together, so that we are able to provide the required care to the patient at an affordable cost within a reasonable period of time. And lastly, from an administrator's perspective, because they are a very important stakeholder of the ecosystem, I see real-time dashboards or analytics that help the healthcare decision makers, both in public and private sector, to manage the population health, and the administrators are able to take data-driven decisions so that we have more effective population health management. So this is the 2025 vision that we have.
Very nice. Mr. Abhishek.
No doubt, digital intervention and use of new technology that is going to change the entire healthcare landscape in coming days. And there is immense potential for that. Availing health and wellness services through various digital tools in a remote manner is going to be enabled through use of technology, and the gap between healthcare service providers and healthcare service consumers, that is going to be bridged in a big way. Coming to challenge part, definitely it is a very big challenge to implement all these new ideas, new technologies. To sum up, I will say the biggest challenge brought about by this pandemic is that the changes are too much in too little time, right? So no doubt, COVID has created or triggered a new kind of ecosystem, a new kind of change. And the entire landscape is going to change. There is absolutely no doubt about it, because this pandemic has changed the mindset of the people. It has changed the way we look at the world around us. Even though we may not realize it, actually the perspective has changed, I will say, at civilizational level, the way we see things, the way we see various aspects, including availing of healthcare services. And there are going to be major changes, major innovations, major use of digital technology. But the challenge, as I said, it would be too much of change in too little time. So it will take time before all the changes stabilize and people get fully used to these disruptive changes and technology.
Kunal, what's your 2025 hat is saying?
Well, they've pretty much said everything, Hema and Abhishek ji. They've spoken about, of course, the biggest challenge is, of course, going to be implementation. But I think the other thing that's going to happen is that, look, technology is changing the world in ways that are faster than we can even comprehend. Each and every field is being disrupted. Each and every field is being changed. And like Abhishek ji was saying, is that we don't even know the scale of how big that change actually is. And obviously, the medical field is not untouched. I mean, we are talking about robotic surgeries. We're talking about nanoparticles in the blood that will be hooked up to a computer that will give you real-time updates. We're talking about genetic editing. These are things that are going to change how we are as people forever. These are humongous changes that are happening. But I think the one big challenge that I see is how many people will really have access to these big changes. What I mean by that is that, we live in a country where people don't have access to basic healthcare. These are going to be huge technologies, going to make huge shifts. But how many people are going to be able to actually afford these technologies that are coming up? And I feel like technology has purpose only when it reaches out to the poorest sections of society. Otherwise, it's not fulfilled its task. And for me, the big challenge I see is how are we going to reach out to, the poorer sections of society, and how are they going to be able to afford this? So I think, 2025 is, when you think about the changes in the medical field, is very, very exciting. I was just reading this book which talks about how aging is a disease. And, like any other disease, we're going to be able to treat aging as well. So those are the sort of things we're talking about now, talking about aging as a disease. But the question really is the implementation, of course, and the affordability. How are we going to make this affordable for everyone?
Oh, very well said, Kunal. Innovation is not always judged by the novelty. Innovation should be judged by the acceptability and affordability also, and especially in the healthcare and industry. Very great discussion, very good conversation. As I said, technology is the catalyst at this time period, but at the same time, we fight this battle with a lot of courage and competency. And here on this screen, if we will see, we all four are from the different industry, but we are working and helping to our people to come out from this pandemic. So I'm pretty sure in 2025, we will have many challenges, but we will have many solutions also. With this hope, thank you very much. And thanks for your time. Thank you.